Welcome to the Charles River, where we envisioned having this series. And even though Stephanie's being very, very generous towards me, really there's a tremendous thanks that I extend to her because this has been a huge amount of work that she's put in and her staff and has put in. So I'm happy to serve as the doc here, but really the walk is in large part due to her. So I'm happy to do this. Also, just so all of you know, I'm a Watertown resident. I moved here just over 2 years ago. And as a primary care doctor, I work in Revere, in a health center in Revere that's affiliated with Mass General Hospital. But I've always been interested in thinking about how I could use some of the areas of interest and also expertise that I have more locally. And so when I started talking with Stephanie about this, really I got so excited to think about how I could share some of my interests in community health and in lifestyle change and behavior change and in health promotion overall. This just seemed like a great fit. So for today's session, I'm going to share a little bit of background information on why I think Walk with a Doc is such an important program. I'm going to share a little bit of information on some of the health benefits of walking and of being physically active, even if it's not walking. And then I'm going to open it up to Q&A because there's a lot going on both in the news, but also in general related to health and related to well-being. And part of the inspiration behind Walk with a Doc is really just to have an informal platform to ask questions to a physician that's available. So I'm not going to give any medical advice for any one specific person today, but I'm happy to talk about some general concepts as they come up. So first, I just want to share a little bit of information here about why I think Walk with a Doc and lifestyle change in general is really, really important to focus on, both on a personal level and then for me professionally. And this is a slide of a diagram that I learned when I was in my first year of medical school. And it actually changed the way that I think about the world and certainly about my profession. So this was a major study that was published about 15 years ago, and it was resynthesized here in the New England Journal of Medicine, one of the premier medical journals. And what they did in this study is they looked at what are all of the causes of people dying earlier than what is expected in the United States. And when they looked at all the causes and they thought about what could be attributed to which cause, it actually turns out that not having health care or having inadequate health care only accounts for 10% of the premature deaths in the United States. So that's where a lot of debate comes around Obamacare and health insurance and Medicare and Medicaid. All of that is focused to help improve the health access that people have or improve the quality of healthcare that people have. But even though we spend so much time debating that and arguing about it, it really only represents a very small fraction of the amount of deaths that we can prevent in our country. Now, another interesting point that I learned about is that 30% of the deaths that are premature or earlier than what might be expected are attributed to genetics, which for better or worse, we can't really do too much about. But when you think about what we can do things about, it's actually quite a large amount. It's 60% of the deaths that are premature are a combination of social circumstances, poverty, not having enough food, violence, etc., environmental exposure, such as chemicals, and then a whopping 40% is related to behavioral patterns. So the behaviors that we engage in, walking or not walking being one of them, is actually an extremely important topic to focus on when we think about promoting health and preventing disease and death. And then if you think about this, it's really not a surprise that the leading causes of death in the United States, and this is from 2000, are actually from conditions that have a very strong connection to behavior changes and healthy patterns. This year, of course, this number will be changed significantly by COVID, but up until this year, the leading causes of death are heart disease, malignant neoplasm, which is a scientific way of saying cancer, and then cerebrovascular disease, which is damage to the blood vessels in the body. These other causes of death in the top 10 as well also have a strong connection to healthy behaviors and lifestyles. So when I think about promoting a healthy lifestyle, I actually am a member of a organization that I think really has informed me a lot about how to organize my thoughts and my teachings around this. And this concept is now called lifestyle medicine. So I belong to the American College of Lifestyle Medicine, which is a great organization. And they have created this diagram which illustrates the 6 pillars of a healthy lifestyle. And these 6 pillars, this is what I spend a lot of my time talking about with my patients, are these 6 pillars which really form the foundation of a healthy lifestyle. And the 6 pillars are healthful eating, physical activity, managing and reducing stress, forming and maintaining relationships, improving sleep, and avoiding risky substances such as alcohol, tobacco, drugs, and sugar. So what we're going to do today, after we have this chat, and it's so beautiful out, it's a gorgeous October day, is go walk and focus on increasing our physical activity. But I really want to emphasize that physical activity is just one part of a healthy lifestyle. And as you focus on each of these different pillars of a healthy lifestyle, the others actually can benefit. So for example, walking today is really good from a cardiovascular perspective, but walking can also reduce our stress levels. It can also help us sleep better. And so a lot of these pillars of lifestyle medicine really work together to promote a healthy life overall. Now, when we talk about physical activity, I just want to emphasize the Centers for Disease Control has a guideline for how much physical activity is recommended for every adult in America. And this is their recommendation. So I'd like for you to take a moment and think about whether you individually are meeting the national guidelines, which is a combination of at least 150 minutes a week of moderate aerobic activity, which means anything that gets your heart rate beating a little bit faster than what it is now while you're sitting. And as you can see, you don't need a dog for today, but walking is one of those activities. And then also at least 2 days a week, doing some sort of physical activity that makes your muscles work harder than usual. So it could be using weights, it could be using bands, it could be gardening, could be housework, but anything that makes you use your weights, use your muscles. And then just finally, I want to emphasize really how much of an important, how much importance there is in thinking about the impact of exercise and physical activity on health. So what I'll show you, I've already shown you that behavior change in general is really important, that most of the chronic diseases that lead to premature death are related to physical activity and other lifestyles. But this is a study that was published just this year in the British Medical Journal, one of the most important medical journals in the world. And what they looked at was 20 years worth of data of almost 500,000 adults. This was not done in America. Sorry, it was done in America, 500,000 adults in America. And they looked prospectively to see if you start in 1997 and you recruit people and you monitor how much physical activity they do, what will happen relative to their death rates or their rates of dying from all different types of individual causes of death, such as heart disease, cancer, and lung disease. And they followed people for, on average, 9 years. So they collected an extraordinary amount of information. And so if you use as the baseline of these 500,000 American adults not exercising at all or enough of what's recommended, then you can see here, this is, let's say, the baseline of 1.0 or 100%. For people who only focused on sufficient muscle strengthening, but they didn't do any aerobic activity, their rate of death went down to about 0.9 or 0.8. So that is what we would call a 10 or 20% reduction in death. If you look at people who were aerobically active, but didn't do the muscle strengthening, their rate of death went to down around 0.7 for most causes, and actually down to 0.4 for chronic lower respiratory tract disease, or COPD. So what this means is that you can people lowered their rates of death by over 20%, sometimes 30%, and in certain cases 60% by being just meeting the guidelines for aerobic physical activity. And then for the American adults who did both, who met the guidelines for regular physical activity, aerobic activity, and muscle training, on average, their rate of death was 40% lower than the people who didn't meet either. For COPD, it was about 70% lower. And so the major takeaway here is that the reason that in Watertown we're promoting this and Walk with a Doc around the world is promoting this concept is that physical activity is extremely important in promoting health and ultimately in preventing death.